Right now, somewhere in a hospital or a clinic or a doctor's office, someone is second guessing themselves, wondering if they're being too much, too loud, too insistent, and then deciding to just go along with it. I've seen it, and I've seen what it costs people. Today, I'm sitting down with Maia, a patient advocate doing powerful work in the sickle cell community, and Flo, a healthcare worker and union advocate who fights for patients and the people caring for them. Together, they bring something rare to this conversation: what it actually looks like to advocate for yourself inside a system that isn't always designed to hear you, why that's so much harder for some of us than others, and the practical tools that can shift that dynamic. If you've ever left the doctor's office feeling like you didn't say what you needed to say, this episode is for you. Welcome to our session today for Octavia's Cure. We'll be speaking to two people in healthcare who know what it means to advocate for their rights. One person is a patient and one person is a healthcare worker, and so we'll hear from all of those perspectives. I want to introduce you to our speakers today. Maia Laing is a passionate healthcare policy leader and advocate with decades of experience dedicated to improving health equity and patient outcomes. She was most recently Chief Policy Officer of Sick Cells. She brings both professional expertise and personal insight as someone living with sickle cell disease, driving forward initiatives that expand access to care and influence meaningful policy change. Maia has built an extensive career in public health and government affairs. She believes that elevating the voices of patients and creating inclusive systems leads to better health care for individuals with chronic conditions, and she works tirelessly to make that vision a reality for the sickle cell community and beyond. Next, we have Florence Brosser. Flo is a fierce healthcare advocate with more than 15 years of experience as a medical office specialist at Mount Sinai West. She also serves as a union delegate advocating for her colleagues and her patients' well-beings. She believes that a positive work environment translates into improved patient care and works to realize the vision for herself, her colleagues, and her patients. So welcome to both of you. Thank you so much for being on this session of Octavia's Cure.
Thank you for having us.
Awesome. So I'm going to start, this session really I wanted us to kind of have this conversation at this time because we are in a time where healthcare really is facing some major challenges. After COVID, a lot of the healthcare facilities that many of us go to are facing some financial challenges. And now with the current administration and HR 1, we know that we're going to face more budget cuts that'll lead to more issues with access to healthcare. That means that as a patient and as someone who may take care of other individuals, the way that we advocate for our healthcare really matters. And so I wanted to have this conversation about what does it look like to work hard to protect your health, to push back if you face a hard situation within the healthcare setting, to get your healthcare team to help you the most, to get your insurance to help you the most. People are really asking these questions, and I want us to be able to answer it today. So I want each of you to introduce yourselves a little bit more and add a little bit of color to what brings you to the spaces that you're in now. So I would love for you to start, Maia. Please tell us about your experience in healthcare as a patient advocate and as a chronic patient yourself.
Thanks, Stella. I always tell people my career in healthcare started at birth. I was born with sickle cell disease. My brother also lived with sickle cell disease, and being a part of the healthcare system was inherent to our existence. And I recall growing up, spending a lot of time at the hospital, primarily because my brother has further complications of sickle cell disease that include asthma. And so there were oftentimes admissions to the hospital, and coming home from school meant spending the evenings at the hospital with my brother. It wasn't until adulthood where I pursued a career in healthcare, particularly on the business side of healthcare, that I was encouraged by colleagues after falling ill and having a long hospital stay to look at sickle cell disease and what that looks like for the healthcare system today. And so I've had the opportunity to look at sickle cell from the federal government perspective, from a large payer perspective, and now particularly from the advocacy perspective and looking at policy. And certainly after just recently giving birth, understanding what sickle cell disease looks like as a woman navigating the healthcare system. And there's a lot of challenges, to say the least, as you've mentioned, that we can talk about further. And I think the biggest one that I've also noted is transitioning, living in one state and moving to another, and navigating new care teams and new settings and the challenges that those create as well. So I look forward to talking a lot more about that. But I'd say that my everyday lived experience has brought me to advocacy, and it's something that I cannot separate from my own existence.
Yeah, literally since childbirth, which is
Yeah.
incredible. Flo, I want to come to you and I'd love to understand. I mean, you really fill the role of a patient advocate as a medical office assistant. And tell us about your experience and what you've seen in the last 15 to 20 years and the work that you've done that brings you to this space of advocacy for patients.
Good morning. My name is Florence Rosser. I go by the name of Flo. I worked for Mount Sinai for 18 years.
Mm,
Before Mount Sinai, I worked as a home health aide. Um, and when you would see what made me go into the hospital to advocate for patients is because when you are a home health aide and you see how the your patient is being treated in a doctor's office, it's horrible. How the transportation, you wait hours for them to be picked up, wait hours for them to be picked up to go back home. It's horrible. So I said, let me go back to school, and I became an medical office assistant. My title was upgraded to medical office specialist. Um, with that being said, as far as working in Mount Sinai and just seeing the different healthcare changes with the insurances now and certain medications are not being paid for patients, especially when it's diabetic, some HIV meds. It's horrible. It's terrible. And you try to talk to the patient to encourage them that don't worry, we'll take care of it, we'll get it paid. Sometimes that don't happen, and you give false hope. And that's what the healthcare system to me now today is giving is false hope for patients that we can help them, we could do it, and knowing that we can because we don't have one, the government funds to do it. Number two, the insurance is cut. So now we have to try to not lose them as a patient from taking care of them for so many years to going on to trying to find somewhere that they can be taken care of with the health insurance is it's not good. It's just not good.
yeah, and I think that it really, what you're getting at, Flo, is that there's systematic changes in policy that need to be made. And I think, Maia,
Mhm.
your background really speaks to that. I'm curious if you could speak to, Maia, the way that you approach advocacy, right? So if you are a patient in this system and things are not going well for you as a patient in the hospital, what have you done historically to make sure that you're heard, that your voice is heard? And then, Flo, I want to ask you the same question, as a, as a healthcare worker, how you support patients when they're not being heard. But Maia, please start.
Yeah, I just experienced this yesterday, in bringing my daughter to urgent care. So I'd say a lot of the work starts in educating oneself around what resources are available to you and how to navigate the system. And that is a very simple statement given the complexity of the system and how challenging it is. I always remind people that, when patients need care, they simply are showing up and looking for a clinician to support them. And that is the simplistic way that they're showing up. However, the system is so much more complicated than that. Where they need to show up, who they can engage with, what's going to be covered, and what they can do in follow up, as Flo has mentioned, based off of what is available to them. And fundamentally, care should not be driven by what people can afford. Care in its purest state should be a clinician developing a care plan and delivering on that care plan for a patient, to meet their best health outcome. And then we should be working to understand how to cover those costs. However, we've gotten to a different state of affairs these days, and that's unfortunate. With that, advocacy does happen at a number of different levels. One, it starts with patients identifying where there are pain points, where there are challenges in navigating the system, and being vocal and communicating those. One, advocating on behalf of themselves, but two, there are pathways through advocacy organizations or directly to policymakers around where those problems are happening at. By elevating those voices, it creates opportunities for us to identify where there are policy gaps. Those policy gaps are both at the federal, state, healthcare, or payer level. And so policy looks like a number of different places. Flo, you touched on where there are challenges in coverage policy and where we're making determinations on what we're going to cover for patients. And there are different instances, particularly as we're talking about implementations from the new bill that is coming, is that at the state level, individuals with Medicaid will have impacts to coverage. And we know that there will be secondary impacts to the third party payer for those with commercial coverage as well. So there are opportunities for individuals to speak directly to policymakers at the state level around the impacts of policy and coverage in a way that helps individuals make decisions at the state level around what is covered. And it's really important. There's things like drug utilization review boards, for example, that are open to public that can talk about what drug coverage is available to patients. Additionally, it'll influence the way that Medicaid is covering individuals on Medicaid, both those that are receiving it directly through the state and those through third party. So I'm saying a lot, there's a lot to say, but in general, advocacy happens on multiple different levels. It starts with an individual raising their voice, and I know that that's extremely challenging, and it's raising that voice to multiple different entities so that these challenges can be made visible and people can begin to start working on them.
And I love the way you mapped it out. Like, talk to your elected officials, let them know that you're not happy with how this stuff is going. Because a lot of times they get health insurance. They get health insurance, by just being elected officials, right? And their health insurance covers everything. And they need to know what it's like on the ground. So I think you're absolutely right about really elevating your voice in that way to impact policies in the system. I'm curious if you could just speak before we go to Flo. I'm curious if you could speak on what it looks like to advocate yourself as a patient, as someone who's getting care. You're in a moment where you're not being heard. Sickle cell is a disease that often relates to very severe pain crises. We know about how that gets treated in the ER, in the hospitals. I'm curious about how you advocate for yourself. What does it look like at that level?
Yeah, it's really challenging. My most recent example is giving birth to my daughter, which is extremely high risk for an individual with sickle cell disease. And for that, I'm constantly supported by a hematologist, which is a specialist that focuses on the blood, which is what sickle cell impacts. And we spent a lot of time talking about what my personal care goals were alongside what my healthcare needs are. And in doing so, we documented a care plan that worked to optimize my health as well as what my personal interests were in my care. And that care plan was established to help my other clinicians navigate through certain care decisions at points in my care where things needed to be coordinated. I will say that the system is still disconnected in the sense that there are not requirements to adhere to care plans that are not standardized. And so there still is a lot of work done again where advocacy comes into place to get these care plans standardized as requirements. However, it is a starting point to improve communication that enables clinicians to understand things from a clinician to clinician level with the voice of the patient integrated in. And so I spend a lot of time identifying my clinicians, building relationships with them, having communication around what my care goals are, around what my interests are. And I have multiple conversations, not just with my specific care team, but others in my community that can help me think through these care decisions. Because again, for someone like me, a lot of the care paths are not well studied or documented. And so there's a balance in making decisions when it comes to caring for individuals with sickle cell disease. And in high risk moments, like for me, where you may need to be transfused, and that may not exactly be the threshold that I'm interested in pursuing, I may need support from other clinicians that are saying, we've come to this plan together and we also agree that this is what's best for Maia.
I think that's so smart because what you're doing is you're almost having the doctors talk to each other. And we know that doctors tend to listen to each other, sometimes even more than patients, which isn't optimal, but it is the truth. And so it's like you have your hematologist speaking to the rest of your team to really set the standards. I think that's brilliant.
We'll return to Octavia's Cure after these messages from our sponsoring partners.
Civic Health Alliance. Healthcare and democracy are more connected than we often acknowledge. The Civic Health Alliance is a nonpartisan coalition working to deepen the connection between healthcare and democracy. And we do so by helping healthcare workers and communities get civically engaged so that health becomes part of how we show up as citizens. Right now, CHA is running the 1,000 Caring Voices campaign, mobilizing health professionals and community members to advocate for policies that protect patients. If you believe that a healthy democracy leads to healthier people, this is your community. Please learn more and join us at civichealthall.com.
And now, back to the podcast.
Flo, I'm going to call you out because Flo and I work together, and Flo is just magnificent at this. You are really good at getting people to understand that they are driving their care and that they have to speak up. And so I have seen Flo say to patients, if you don't like the way somebody takes your blood, ask for someone else. Or if you can't get to see the specialist you want to see, call your insurance and demand that you get someone who's in their plan as a specialist to follow up with. So can you just speak to us, Flo, as a healthcare worker, about how you guide and counsel patients that you take care of to really be able to advocate for themselves and to get what they need?
So the first thing I tell a patient is it's your health, not theirs, right? So if you seeing a doctor, you're not comfortable with the doctor says something that you don't agree with, you question it. Question the doctor. You have all right to, because they giving you things and having you take things that you might not want to take. Ask them why you need to take it. Also, like if they not sure about a certain condition that they have, I go online and I type up the condition for them, print it out for them. When you on your way home, read this. This is what they saying that you have. You can treat it multiple ways with this. If the insurance don't cover it, let me know, and trust me, I'll find a way to get it covered. We'll figure something out. But we are not gonna let you leave without having something and leaving with peace. It's nothing like going to see a doctor and they say, okay, well, you have diabetes here, just take this pill. Why am I taking this pill? Is there something else I can take to help that would be better than just a pill? A lot of patients have diabetes and they want the injection. And I have to explain to them, listen, you want the injection because you want to control the diabetes, or you want the injection because you want to lose the weight. It's two different reasons why you want this medication. And if they say, oh, well, I want it because I need it for both. Okay, well, then make sure you take both. And if most of my patients I have a rapport with, so I'll call them and say, hey, did you take your shot? How's the shot going? How's this going? And they'll, call me and say, well, it's not going. I ain't taking it. I say, okay, but then if you're not going to take it and you're doing it every other week, or if you're doing it on off days, then you should not be having it. And I'll let the doctor know, listen, I spoke to this patient,
Mm-hmm.
XYZ, and they're not taking the medication correctly. I don't think that they should be taking it because you're going to harm yourself more than it's going to do you good. Um, if a patient walks in, like we have a lot of patients that are needy, they walked in, we had one the other day because they denied him for nursing home. So now that he has 24-hour care, I'm like, yeah, but we have in our system where we work, we have patient navigators who can go to the home. We have social workers who can help them with, getting transportation and getting certain things. And I'm like, we have care coordination. Why his case can't be open? Oh, because they just closed it 2 months ago. We need to find out why it was closed and they need to open it ASAP. The man needs help. He can't do it himself. He needs help. So what happened yesterday? They came back to me, oh, Flo, the case got opened back up. I said, yeah, because I spoke to everybody down the line. Like, we can't just leave the patient like that. It's not fair. And we
Yeah.
have my patients
Yeah.
that
And
are paying in the
this
behinds,
is
and we have our patients that are not. But a patient is a patient, right? And we human like they are, and we don't know. I always put myself in their shoes. We don't know when we're gonna need that same help. So the help that I'm giving, I expect when I need it, I get the same. And if I can't get the same, I'm able to to
and
advocate
I
for
just
myself to get that. And
yeah.
that's
Yeah,
me every
well
day in the
said,
clinic.
Flo. And I always wish that there were more flows. I always wish that there were more flows in all of the clinics because you're so tremendous at what you do. And I'm curious, Flo, just staying on you for a moment.
Hmm.
And I want to ask this of both of you. I think I have a sense of why this is, but I would just love to know, what do you think, what makes it hard for patients in terms of standing up for themselves for what they need in our health systems? And why is it particularly hard for patients who come from minoritized backgrounds, like Black patients, women, people of color? What is it about our system that makes it hard? And I think kind of being able to diagnose that and talk about that is important as we think about what some of the solutions could be.
So, the number one thing for us as being black, Spanish, black, brown, however you want to call it, whatever you call yourself, is information. You don't go anywhere and see any information posted up anywhere, or you see flyers being handed out, or you see flyers posted up in your clinic or in your hospital saying, that if you have any problem with certain things, you can call here and get help with this. You only see things about PrEP, which is okay, but we need more than just PrEP. It's not just about HIV. Everybody don't need an injection or medication to prevent HIV. We need to prevent diabetes. Where is the seminars? Where is the education on how to prevent diabetes? If you do have diabetes and you are your A1C is just at the level, how do we reverse it without giving you medication? We don't have things like that. um and then so we because I'm in a union 1199, we stand out for healthcare because of course we 450,000 strong across all 5 states. um we do rallies like they tried to do the Medicaid cut, the budget cut. We went to Albany last month and we had over, it was probably about like almost 10,000 of us in the big arena in Albany, and we had Governor Holko come, and every legislator was there. You need to hear us on about our health care and the budget cuts that y'all not putting the money and the funding into the you're not putting the budget together, and you're not including funding for healthcare. And we need it. The hospitals need it so that they can strive and still take care of the patients. The patients need it because they still need to be taken care of. So they heard us. We received some money. I'm not sure how much, but we was asking for, I think, 2 million, and I think we kind of reached that mark, to give back to the hospitals, not for us as a union, but to give back to the hospitals because the patients need it and the hospitals need it. Because if we don't have the money to take care of the patients, what we do, they come through the ED and we send them right back out, knowing that that's not the correct way. They need to stay, but we can't keep them if they can't take care of them.
Mm-hmm. Mm-hmm. So
And
it's a combination of patients having the education that they need, and also it sounds like a degree of the system having the resources to provide
to
patients what
provide,
they
yes,
need. Maya, I'm
exactly.
curious about how you would answer that. What makes it hard for patients to stand up for themselves to get the kind of healthcare that they need, especially as Black and Brown folks?
Yeah. There's a number of things that contribute to this. One, most people are healthy as children. And so when they have healthcare needs, this is something extremely new to them as far as advocating for their needs. I think historically, members of the African American or Black community are conditioned not to speak up when they have needs, to internalize what their needs are, and to feel as though their burdens are their own to carry. And so they struggle to be able to put those needs out there to allow others to pick them up. And those struggles are real because they've also been met with environments where when they express their needs, those needs are not met. And the healthcare system is a great example of that. When people are expressing what it is that they may be experiencing, and those expressions are met with suppression, maybe dismissing how they're feeling, not looking into what is happening, telling them that what they're feeling is not what's actually occurring. We also have a lack of education around the healthcare system. And again, I will say it's extremely complex. So we don't know how to navigate it. We don't know what's occurring. We don't know what needs to be said. There's a particular language that you have to speak in that we're not aware of. And so just knowing the English language is not enough to help you navigate the healthcare system. Expressing things like pain or understanding the impacts of not being able to sleep and what that means to your health as being being an indicator. And so when we're expressing what our health looks like, it doesn't translate to the language of the healthcare system to rise to a level of urgency where a clinician may take action. And so there is a communication barrier, even though we're all speaking English, and though we may all be aware of this, the healthcare system doesn't take responsibility for that understanding in knowing that there's individuals that don't know how to communicate with them and trying to lean into that and pull more. I've also learned too that we invalidate people when they speak, and so instead of taking what they're saying as truth and working through that, again, we dismiss what they're saying. We may go to simplified answers. We are balancing out the costs of care. There's also a lot of stigma associated with economic status for individuals with sickle cell disease, for example. There's a lot of stigma associated with uh, drug seeking behavior, though at the core of the condition is pain. And so, of course, someone might be seeking, drugs in order to feel better. And so there's this inherent reinforcing, bias that is occurring based off of the nature of the condition. So everyone's responsible here, I would say, as far as the breakdown in communication that occurs, particularly for people in the Black community. However, I do think there is a greater responsibility that sits with the healthcare system in helping to identify and address the needs of patients, given that patients don't have the sophistication to navigate the healthcare system that we've created. And so there's a lot occurring. I also think as a people, we have to learn to speak up, and we have to learn to say when something isn't right, and we have to learn to not stop speaking up when something isn't right. And to Flo's point, we have to, if we can't get what we need from one individual or entity, we need to find someone who's willing to listen, to advocate for us, to help and address those needs, because our health is at the core of our essence, and it's what is required to live.
Well, I want to ask you guys the kind of Octavia's cure question about imagining a better healthcare system. And so, in an improved healthcare and public health system where we have the optimal kind of patient advocacy existing, what does that look like? What does that mean to you? And I think about this a lot, and I will share with you that as a doctor who sees patients, what it looks like is every time a patient experiences something in the healthcare setting that isn't optimal and they make a complaint or they talk about it, that there's actually real work that happens for us to show that that feedback is being incorporated. Too often we have people have horrible experiences and they talk about it or they share it and it just goes nowhere. But in a better system, there are ways that we really capture this, we make the improvements, and we show that we've made the improvement based on what this patient has shared. And I'm just curious for you, maybe Maia, that we could start with you. What would it look like in a better system?
Yeah, I love what you just stated. And to build on that, I think in a better system, advocacy wouldn't be required, because when we get the system right, every patient's needs are met the first time. And until we get to that point, we have a lot of work to do. So I hope for a world where we have a community of healthy people and people's needs are met when those needs are present, and advocacy is not needed.
Beautiful. Flo, what would you say for that future world where patients can advocate for themselves in the way that's optimal, or even advocacy isn't needed?
Well, I would say like a clinic that we run now, you have everything under one roof. So if a patient has a problem with medication, we have a nurse to speak to them about it, to give them the medication adherence. If a patient has a problem with the insurance, we have social worker right here around the corner that can help you with your personal needs, as you know the social workers do. If you need help making appointments, around the corner, just go over there. Patient navigators is there. They're gonna help you there. You know, just everything under one roof instead of I'm going to 114th Street for this. I have to go to 16th Street for that. I have to
Mm-hmm.
go 13th Street for that. Brooklyn for this. One, everything under one roof, and the patient just move along and across the board is always perfect.
I love that. Thank you both so much.
You're
I
welcome.
want to close with some advice that I heard from each of you. I'm going to close with some advice that I heard from each of you, and just share with our audience one action, because Octavia's Cure really focuses on getting insights about improvements in healthcare and then translating it to action. Based on what you've all said, I would say your voice matters to all of our listeners because you know your body, you know what's at stake, you know your life better than anyone else in that room with you, in that doctor's office, in the hospital. So advocating for yourself is not selfish, it is necessary and it is vital. We encourage you this week, this month, to do one thing, to use one of the techniques that we talked about. We'll be able to share that with you on our website so you can see them if you want to revisit them or listen to this conversation again. We encourage you to use one technique, to ask one more question, to bring someone with you who can ask questions, to do your own research. Take one small step towards reclaiming your power as a patient. Because as part of the Octavia's Cure team, we believe that cure isn't something that's just given to you. It's something that you build for yourself, that communities build for themselves, and that building this cure is going to be vital for the future of healthcare. So thank you for imagining with us, and take care of yourselves.
Octavia's Cure is a production of Just Equity for Health. This episode was hosted and executive produced by Dr. Stella Safo, with production by Amanda Misiti, our creative director and producer. Post-production and graphics by Simon Cowart, and digital content production by Devon Johnson. Please learn more about our work at octaviascure.com. If you love Octavia's Cure, please subscribe wherever you get your podcasts and leave a review so more listeners can find us. Thanks so much for listening. Look forward to seeing you next time.